Welcome back to Stop Fainting Snippet. Now, Trish, on our website, we often get questions, quite a few questions, about people who've fainted or passed out after a vomiting attack or when they're ill. Is that something to worry about?
Well, we've always said that if anybody passes out or loses consciousness, it's always something that you want to explore. However, I think a common concern that we come across is when people have had, they've eaten a dodgy prawn, or they've got gastroenteritis, or they've been unwell and they've been vomiting, and whilst they've been vomiting, that they've lost consciousness, and maybe they've banged their head, or maybe that they've been quite distressed, especially if they've been on their own. And what very often happens is that they may go to hospital and they're told that they're okay, they might need fluids, they're a bit dehydrated because they've got a stomach problem and maybe they have been vomiting for a while. And they're told that just keep hydrated. But I think very often patients don't understand the connection between why you might faint when you vomit. And therefore they find that fear of why it's happened or why it may happen again, and is it dangerous, is something that carries on unless they fully understand that.
So, Boone, why do people pass out when they vomit?
So there are two components to the question that I'd like to unpick and extend it further down the GI tract, if you don't mind. It's very common as part of the pre-syncopal program. That means what you feel before you faint, and the rising sense of doom, and especially in the immediate preceding component of the vasovagal syncope reflex, when your blood pressure is falling, it tends to trigger what's called a parasympathetic response, and that can make your bowels and your stomach behave slightly oddly and make you feel like vomiting. So there's chicken and egg side of this now, which is vasovagal syncope can trigger vomiting because it's one of the reactions in the vasovagal syncope phase. But I think what Trish is alluding to is the other side of the chicken and egg story, that vomiting can also trigger vasovagal syncope. And this is commonly seen in patients who, for example, wake up in the middle of the night with feeling nauseous and needing to vomit, or more commonly, abdominal cramp and the need to defecate. For example, if you had kind of a dodgy curry, for example, and you need to get to the loo because you're about to have a period of loose bowel motion, that rising feeling of bubbling in your tummy, which is very uncomfortable, and the crampy sensation can often in itself trigger the vasovagal reaction. So I think those two things are said just for the patient's understanding, but actually the kind of crux of the matter is that neither of these things point towards anything that's more sinister or dangerous with your vasovagal syncope episode. It's still ultimately a vasovagal reflex. That means your blood pressure drops and maybe your heart rate drops, but it's momentary. And so long as you heed your warning symptoms, get down to the floor, elevate your legs, and avoid falling from a great height, this is very helpful.
Great.
Can I just add something to that? I think we've all had, even I don't have vasovagal syncope, I've never fainted, but I know that if you do vomit, you can feel clammy and sweaty, and you have all those pre-syncopal symptoms that people do have when they're about to faint, because you trigger that reflex. And I think if this is the only time that you find yourself fainting is when you are vomiting or when you're unwell, then yes, the plan is to do all the things we do for vasovagal syncope prevention, which is to keep hydrated, but maybe focus on what is that's giving you that gastric illness in the first place, and try to avoid that as a trigger, same way we treat it as a trigger for anything else.
And the top tip, not top trivia fact, is that your gut lining has more neurons than any other part of your body apart from your brain. So that's your second brain lies in your gut. And that's why there's so many vagal responses and so much connection between the gut and the brain to kind of trigger this kind of responses. So it's all connected.